out that found a needle exchange program here in the district has led to a big drop in HIV infections.
Yeah, this is huge. The monthly rate of new HIV infections dropping about 70% after the program was started in D.C. back in 2008. Here with us to tell us more about these findings is Monica Ruiz, the lead author of this needle exchange study. Monica, thanks for joining us here.
Thank you for having me here
this morning. 70%. That's astonishing.
It is. It is really tremendous, and it shows what the impact of changing policy can do to help people get the type of health care they need, the type of services they need to prevent HIV infection.
Sure. For people who might not know, how did this needle exchange program work?
So, just a little bit of a correction. There was a needle exchange program in D.C. during the time that this thing we call the D.C. ban, that legislation was in place. What the removal of the D.C. ban did was to allow D.C. to use its own municipal revenue, which it couldn't do before. Every state and locality was able to do this, but D.C. could not because of the federal legislation. Now D.C. was able to use their own municipal revenue and deploy resources to expand the existing needle exchange into a network of 4 needle exchange services throughout the city. So that really enhanced the ability of people to not only access clean injection equipment, but also health care, access to services, being able to get referrals to drug treatment when they're ready to quit. That's what made it so huge. And it shows that policy change really can make a difference. Evidence-based policy does have an impact on people's lives, and it does save money. It is cost-effective.
Does this give you the impetus then, or kind of some of the research, the numbers, the pure meat to then go after other changes that you want to make? Because sometimes policies are meant for good, but at the same time they can't stand in the way. And people who say, wait a minute, why are you doing this? This doesn't make any sense. You're spending our money for this. Does this now help when you have these kinds of numbers to go after the next level that you want to?
This adds to the abundance of research on the effectiveness and cost effectiveness of syringe exchange programs. So I'm hoping that this will be another arrow in the quiver of ammunition to change policies that stand in the way of people accessing services that they need to prevent HIV infections.
In your opinion, what needs to be done to bring this number down even more? Is there a next step, or do we just continue with the current policies and the way things are going right now?
Well, I think this is just a starting point. I mean, what we've seen in this study is we looked at the first 2 years after the policy change, and we saw this dramatic reductions, 120 averted HIV infections, which is huge. It's really, really huge. And if we look at what's happened since then, the numbers have dropped even further. I think, I could be mistaken, but I think we're in the double digits of new HIV infections associated with injection drug use. So that's a continuing decline. To be able to continue to prevent more HIV infections, as well as prevent Hep C infections and other infections that are borne by needle use and sharing, to be able to expand these services and make them more comprehensive so that people can get access to care. They can get access to services. They can get those referrals to drug treatment. For many people who use syringe exchange programs, these are the sole sources of care that they have, the sole sources of care with which they feel comfortable. Many of these folks are so marginalized from traditional healthcare resources, so when these services are there for them, they take advantage of them. They go and they get their blood pressure screening. They go and they get their HIV testing. They get linked to care if they're HIV positive. These are hugely, hugely important services for this marginalized community.
We've got about 20 seconds left. For someone who wants to find out more about this program or the study, is there a website they can go to, or who can you call?
The District of Columbia Department of Health, the HIV/AIDS Services Administration, has some web information on the needle exchange programs. You could also go to the individual sites like HIPS, Helping Individual Prostitute Survive, Family Medical, Bread for the City. These are all needle exchange services that are available in the district. And if anyone would like more information, they can always reach me at the Milken Institute School of Public Health at the George Washington University. I'd be happy to talk with anyone.
Okay,
Awesome.
How fascinating. Yeah, congratulations and good luck with continuing this.
Thank you so much.
Well.
Thank you for your time and interest.
Monica Ruiz, thanks for joining us. 8:10 right now. You may not need to